Sam Martin is a nurse and midwife at Melbourne's Royal Women's Hospital. He contracted coronavirus at the start of July. He joins me now. Sam, very good morning to you. You're, along with your partner Sarah, a part of a Victorian government campaign to try to get the message across to people, young people in particular, about how easily people can contract the disease. Firstly, I want to ask you, how's Sarah going?
Good morning, Michael. Sarah she's back home with me, so she's out of hospital, which is nice. Unfortunately, still not doing terribly well. Still quite struggling with the basic day-to-day tasks, but we'll get there. Slowly but surely, we'll get there.
How long has Sarah had the virus now?
So it's been almost 6 weeks for Sarah. We're quite surprised by how hard hit she still is by this virus, that she is still so unwell.
And what were the initial symptoms? I want to ask both of you, but firstly, in Sarah's case, what were the initial signs that she could have had coronavirus?
So for Sarah, the first main symptom that she had was actually just a headache. And that was something that, we often walk around with a headache and kind of just ignore it. But being a close contact of mine, after I'd already tested positive for coronavirus, she knew straight away that meant she had to go and get tested. And unfortunately, it was positive when she did.
And for you, Sam, when did you sort of get the suspicion that you might have also have contracted coronavirus?
To be honest, I genuinely didn't expect to have tested positive for it. I got tested for a runny nose on a cold winter day. Runny nose being a symptom that we knew to look out for, but it was a lot more mild than I thought it would be. I did the right thing, went and got tested to try and protect the other people that I was with, fully expecting the next morning to get a negative message and go back to work and go on with my normal life. But obviously that wasn't the case.
No, and how are you feeling now?
Not too bad. There's still some kind of lingering kidney pain, body aches, and as you can probably tell, I'm very short of breath all of the time. And that's something that, concerningly, now that I am testing negative for the virus, a lot of the medical staff that are looking after us have said, well, this is probably just going to be a chronic issue and we don't really know how long it's going to last.
Yeah, we keep reading increasing numbers of medical studies along those lines. How much does that concern you, that you might have, and Sarah as well, these after effects for many months and possibly even years?
Well, I guess that's it's kind of been a common theme with this virus. Being a novel virus, we don't know so much about it, and there is so much fear of the unknown when you're going through it. It is quite concerning just knowing that we don't know what the end point of this is, especially with Sarah as unwell as she is now. Like, she can't function in a day-to-day capacity. How long is that going to last for is always that concern. And as you said, it could be months, it could be years. We just simply don't know yet.
As I mentioned, Sam, you and Sarah are part of what I think is a really good and hard-hitting campaign launched by the Victorian Premier yesterday. What message, if you could sort of sum it up in a couple of sentences, what message would you and Sarah like to get over to people, especially young people, about this wicked virus?
Well, I think the main message from us is that the virus, it does not discriminate. We're both young, fit, healthy, and it put us both in hospital. It still got Sarah completely incapacitated, basically. So regardless of who you are, how old you are, how well you are, we all need to take this seriously. And I think the important part of the message would be to be thanking the people who are doing the right thing, but hopefully reaching out to the people who aren't quite on board with this yet, and hopefully helping to change their minds and, get on board with what everyone else is doing to protect our community.
Well said. Sam, listen, get well as soon as you can, and please pass on our best wishes to Sarah too. Thanks for joining us.
Thanks, Michael.